I'm Dr. Natalie Blache with UT Medical Center, and March is Endometriosis Awareness Month. So we are going to talk a little about endometriosis today. Endometriosis is when cells that make up the lining of the uterus are growing in other parts of the body outside of the uterus. The most common places for this would be the bowel, the bladder, the lining of the pelvis called the peritoneum, the ovary, and least common places like the nose, the lung, and even scars like a C-section incision scar. Over 200 million women worldwide are affected with endometriosis. The most common presentation of endometriosis will be pelvic pain or infertility. The only true cure for endometriosis would be removal of the ovaries. This is usually not feasible for women of reproductive age because the ovaries do serve a positive purpose in the woman's life, producing estrogen and having some protective benefit for women. And so usually what we do is treat endometriosis and its symptoms with things such as hormonal birth control to suppress the menstrual cycle. We do surgery to ablate the implants of endometriosis, and we also treat with anti-inflammatory medications. Not all women are actually symptomatic with pain from endometriosis. Some present merely with infertility and then are diagnosed with endometriosis during the workup of infertility. The only true way to diagnose endometriosis is visualization on laparoscopy, which is looking in the pelvis with a camera, seeing the implants of endometriosis, and ultimately the 100% true diagnosis is biopsy of those implants and confirmation by a pathologist. We see women that come in our office that also have complaints of GI symptoms during their menstrual cycle. Endometriosis can present with diarrhea or constipation, painful bowel movements. Women can also present with painful intercourse. Endometriosis is very inflammatory, and these implants grow during the menstrual cycle and bleed and become inflammatory. They can cause scar tissue, which is a big part of the infertility problem with endometriosis, from scarring of the tubes. Structures can scar to each other and things can be less mobile, and thus the presentation of painful intercourse. We can treat endometriosis just by the assumption that someone has it based on their symptoms. You don't have to do a laparoscopy to treat someone for presumed endometriosis. More common than not, we will treat a patient based on symptoms and see if they improve with standard treatments for endometriosis, such as non-steroidal anti-inflammatory medications or hormonal suppression of the menstrual cycle. So if you happen to have any of these symptoms, it's a good idea to address this with your OBGYN at your annual exam, or even just making an appointment to discuss these symptoms. Thank you.